All right, hi, my name is Martin. This is my head to toe assessment video. I'm going a little quieter now because I don't want to be too loud. I've documented my patient's blood pressure, temperature, pulse ox, and his other vitals. I'm in the correct uniform. I'm going to perform hand hygiene, go into the patient's room, check his two identifiers. Can you tell me your name and date of birth?
Slate August 07/02/2004.
Awesome. And I also checked in his chart, so technically 3 identifiers because it's got the picture and all. Do I have your consent to do this head to toe assessment? And are you doing it for work or anything like that?
Yeah, I'm doing it for school.
Okay, so he's doing it for school, so we know why. So now I'm going to move into it. I'm going to first inspect the color of his nail beds and the curvature and where the nail meets the skin. So I can see that is all looking pretty good and dandy. Nice. Next one. Good stuff, good stuff, good stuff. And awesome. And now I'm going to inspect his and palpate his scalp, hair, and cranium. I'm going to palpate for any lumps, masses, or soreness. So let me know. I'm going to run it through here. I don't see any dandruff. His hair looks good. No lumps or masses. Does any of that feel sore? No? Okay, good. And everything looks good. I didn't see any scarring, so no past surgeries in there. And I'm going to assess his cranial nerve number 7. I'm going to check for face symmetry first. So face is pretty symmetrical. I could cut it in half and it would look pretty good. And now I'm going to assess the mobility of the face. So can you go ahead and smile, frown, move your eyebrows around. All right, good. And one more thing, close your eyes, open them, and puff your cheeks. All right, so cranial nerve 7 seems to be intact. Now I'm going to move on to cranial nerve number 5, which is the trigeminal nerve. I'm going to assess the motor function, and I'm going to palpate his jaw and temples. So go ahead and clench your teeth. Good, good. Jaw, temples. Good. Alrighty, now open and close your jaw. All right, everything feels good with that. And let's see. Now I'm going to assess his sensory of his face with a cotton ball I have here. So I'm going to grab this cotton ball out of the tape. I'm going to touch his face with it, and then I'm going to go to palpating his temporal artery. So let me close your eyes. Let me know when you feel something touch your face, if anything at all.
Yo.
All right. Now the other side.
Yo.
Alrighty. So his sensory of his face seems to be good. Now I'm going to palpate his temporal artery. All right. Good. Good. So he's got a nice strong pulse in his temporal artery, and that is good. Now I'm going to check his temporomandibular. And I did that earlier, but I'm going to do it one more time for good measure. So open and close.
I guess I could just hold this.
All right, so his temporomandibular is good. And now I'm going to palpate his maxillary and frontal sinuses. All right. There's no puffiness, so that's good. And I'm going to lift his hair up just so I can get a little inspection of that. All right, and that's good. So now I'm going to move on to his eyes. I'm going to test his visual fields by confrontation. All right, go ahead and let me know when you can see my finger or when you can't see my finger anymore.
I cannot.
Look straight.
Just look straight.
Look straight. Look
And
straight.
that's where you put your hands.
I cannot.
All right, let me know when you can see it.
Yep.
All right, now the other eye. Let me know when you can't see my finger anymore.
That's your answer.
Nope. Still there.
All right, let me know when you can see it again.
There.
That's the vibrations you
So I just tested all that. Now I'm going to move on to his next cranial nerve. Let me actually put on some glasses here so I can better assess this. All right, now I'm going to move on to cranial nerve 4 and 6. It's the trochlear and abducent. I'm going to do his 6 cardinal positions of gaze. I'm just going to use my pen light. So keep your eye on this pen light and just follow it. Good.
You're on symmetry, right?
Good. Good.
Okay, yeah. Well, why don't you just? What are you comfortable doing? What do you think you can get?
Good. So he followed it well, he did it well, and now I'm going to inspect his eyes. I'm going to go ahead and shine my pen light in there and check for perula. So first things first though, I'm going to look for any discharge, discoloring. You're good, you're good, you're good. Nice. Pull that up. Pull those eyelids down, pull them up. Did any of that feel weird when I was touching around? Okay. So I just inspected. I didn't notice anything irregular. No discharge, no irritation as reported by the patient or that I observed, no redness or abnormal movement. Now I'm going to move on to cranial nerve 3, his ocular motor. I'm going to take this pen light and I'm going to check for perula, which is, I'm going to check for bilateral equality. Good.
Well, not deep. You just
Good. So his pupils were equal, they were reactive to light, they were round, and I said equal, but bilateral equally. So now I'm going to inspect his ears. I'm going to look at his uricles and his pinna, and I'm going to look at the color, the symmetry, the elasticity, tenderness, and any lesions. So nice and good. Looks good. Did any of that hurt? No tenderness. It's elastic. And I'm going to go ahead and shine my pen light in there a little bit. No excess of earwax or anything. No discoloration. And check this side. All right. And I'm going to go ahead and move around to this side so I can get a better look at that ear. Any of that feel tender? No? It's elastic. Its perula looks good. No excess of earwax. All right, I'm going to close your ear up real quick and I'm going to whisper. And whisper 3 words. You let me know what you heard.
Apple, banana, orange.
Good. Now I'm going to move to the other side and do it. Let's see. Alrighty.
Apple, banana, orange.
I'm going to try 3 different words though.
Soccer, basketball, football.
All right, and those were all the 3 words I said. And now I'm going to move into his nose inspection. I'm going to look at the color of his nose, the size, the symmetry, any drainage, flaring, or tenderness. So, any of that hurt?
Nope.
Nope. No masses, no lesions. He doesn't have any nose piercings. Can you lift your head up a little bit and look in there? No drainage. A little snot, but that's not abnormal. Are you sick or anything? Do you feel sick? No? Okay, good. He probably just has that. And now I'm going to do a sniffing test. So I'm going to go ahead and grab this alcohol pad and close your eyes. I didn't just say alcohol pad either.
What did you say?
So let me know what you smell.
I smell alcohol.
I'm going to grab something else just to throw him off a little bit since I, outed it. Let me know what you smell.
Marker.
He smells a marker, so it's intact. That's good, and there weren't any piercings like I said before, and he smelled everything, so that's good. So last time when I was doing the 6 cardinal gazes, I forgot to make sure fully that his eyes accommodated, so I'm going to do that real quick. Can you just stare at this for me? Alrighty, good. Good. All right, so they do accommodate. I just wanted to do it more in depth, and now I'm going to be checking out his mouth. I'm going to use my pen light. I'm going to look at his lips. I'm going to look for symmetry, color, lesions, if they're dry or moist. All right, so just stand there, be your perfect self. Don't open your mouth yet. Have you had any chapped lips or anything lately? No chapped lips, so everything looks good. His lips look symmetrical. They're moist. Well, not moist, but they're dry within normal limits for the lips. And like I said, they're symmetrical, no lesions, no chapping, so that's good. And now I'm going to ask him to open his tongue. I'm going to go ahead and inspect his tongue, the movement, any lesions, colors, dryness, moisture. All right, go ahead and open your mouth. Move your tongue up and down, side to side. Good. Now move it up again. I'm gonna check under there. No lesions. Okay, now stick it down. Good. So there's no lesions. I didn't see a tongue piercing. Do you have one hiding in there? No, he doesn't. Just wanted to make sure because sometimes you can only see so much. All right, and now I'm gonna go ahead and look at his gum and buccal membranes. I'm gonna inspect that for color, lesions, dryness as well. So can you go ahead and smile for me? Lift her up. There you go. Blow that cheek out a little bit. Good. And then down. Good. And good. And everything looks normal. You got white teeth, guy. Do you brush your teeth a lot? All right. I noticed his teeth. He didn't have any dentures. You got any cavities? I'm gonna look for some cavities. Good. Good. Doesn't have any cavities. Have you ever had a filling? No. So he's never had a cavity. He's a perfect kid. Good for him. And now I'm going to go ahead and check his tonsils and his uvula movement for hard and soft palates, color, redness, back of the throat, gag reflex. All right. That. Go off. All right, his uvula move back, and just let me know when you gag.
Alright, and then whenever you don't have phones on your back, just say 99.
Alright, so his gag reflex is in place. Hard and soft palates were good. And yeah, regular color, no lesions. And it was moist, so good. Alright, so now I'm going to move on to the neck inspection. I'm going to inspect his neck and head movement. I'm going to look at his thyroid gland as well for any movement or anything like that during swallowing. So, inspect the thyroid. Good. Can you swallow for me? Good. Everything looks and feels good. There wasn't any. Is there any tenderness in there? There's no. He doesn't report any tenderness. I didn't feel any swelling, so we're good on that. Now I'm going to palpate his neck a little more and his lymph nodes as well as his trachea for size or irregularities. So good, 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 good. His trachea. And good. Nothing irregular that I felt. Size was within normal limits. And I'm going to palpate his carotids one at a time. Alrighty. I don't want the poor guy to pass out. Good. Now I'm going to auscultate or listen to his carotids.
We're going to do the feet and
warm it up a little bit, just in case it's cold. Good. Alrighty, and everything sounded good. I was doing that. I was listening for any bruise or anything like that. And I'm going to go on to cranial nerve 11, which involves his spine. So I'm going to check his head and neck movement. So can you sit up for me a little bit? You can go ahead and lay that way. Alrighty. And real quick, I'm going to come back. No, you sit down there, son. Shrug your shoulders for me. Good lad.
Yeah, but you have to.
Good. Now backwards. Good. Now turn your head around for me. Side to side. Up and down. Now kind of just flex your shoulders real quick in your head. Alright, good. Nice. You've been in the gym. Love it. Alrighty, so I did that, and now I'm going to inspect the back of his chest. So I'm going to move back on this side for the size, symmetry, and misalignment of his spine. So go ahead and breathe in for me. Breathe out. Good. Breathe in. Breathe out. Good. Spine looks good. Can you stand up for me real quick and touch your toes? I'm going to move back around here. It's okay. And look at this. Good. His spine looked good. Nice curvature. Stand up for me. Good. You're good. Sit back down. So everything was symmetrical, no misalignment of his spine. I'm going to palpate once more for crepitus, tactile fremitus, and I already did his equal thoracic expansion, so that's good. No crepitus felt, no tactile fremitus. Does any of that feel tender? Alrighty, and then got a little acne, that's normal. Has any of that been bothering you? No? And you've had these freckles and moles for a while?
Yeah.
Okay, so that's normal. Just wanted to check in and ask. And now I'm going to auscultate his back for lung sounds. Alrighty. Breathe in for me. In. and out, in, and out, in, and out, in, and out, and in, and out, in, out, in, out, in, out, in, and 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 out, and in, and out,
You're not supposed to.
and in, and out, and then one more time, in, and out. All right, and everything sounded good. And lastly, I'm gonna check for his CBA tenderness. So you let me know if any of this hurts. Hurt?
So now you have
Hurt?
to
Nope.
and we have to.
And that's it. All right, so now I'm going to move into the front of his chest or the anterior of his chest. So I'm gonna inspect it. You breathe in and out. So good size and symmetry during that. And I didn't percuss his back, so I'm gonna go ahead and do that real quick. So you're good right there. Good, just listening for anything.
Wait, I'm not.
Good. 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 All right. And now I'm going to move on with his chest. So I just observed the chest movement a minute ago for a normal diaphragm during respiration. Can you do it one more time? Breathe in and out. Good. So everything was normal. Just wanted to do a double check. And now I'm going to auscultate his lung sounds. But before I do that, I'm going to go ahead and percuss. So good.
Okay, I'm gonna take a look at your legs now, okay?
Good.
Problems with your legs?
Good. And now I'm going to go ahead and auscultate. Or as the ancient Greeks called it, listen.
Lesions, nothing like that. Check out for your refill on your toes. I'm gonna pinch toes, okay?
Good.
So how did you see
And
you
up.
video me and then video her?
Good.
All I did
Good.
was
Okay, do you have any pain or tenderness in your legs?
Hey, if you can get both of us.
Swing your legs, I'm gonna come feel it, if it hurts, okay?
I saw the chart like one time, and then I thought this one time.
I just did it the entire time. Clipboard and there was something I was thinking of. Yeah, clipboard. I'll just. You reach out the legs.
Good. And
Yeah. This one just started.
Alrighty, so I didn't hear any crackling, wheezing, or anything that would indicate any abnormality, so good job to you. Do you smoke or anything of the sort? No, just keep it like that. So he's drug-free, that's good. I'm going to inspect a little more of his upper extremities. I'm going to look for the color, any signs of poor perfusion, and real quick, I'm going to check his palpate, or not his palpate, his capillary refill. So good. Good. And before I do all that, I'm going to go ahead and listen to his heart, just so I can go ahead and knock that out. I'm going to listen with the diaphragm and the bell. Alright.
You're gonna inspect, you're gonna pulses, capillary
You got a strong heart, guy.
Three. Do you have any problems with your legs, anything like that? Nope. Okay, so I'm gonna take a look at them.
Good.
Legs look fine, no lesions, anything like that. You have any,
Good.
ever have any problems with your feet getting cold? Nope. Okay, I'm gonna test the capillary refill.
Cold feet, cold feet. I didn't make sure you could,
That's good.
Good.
Okay, I'm gonna look up for tenderness or pain in your legs. Does that ever bother you? Nope. Squeeze your legs, calf muscles.
Good.
Good.
I don't believe it. It was the right.
Alright, good. Everything sounded good. No murmurs, nothing like that. Your heart feel alright to you?
Yep.
Good. Is there anything weird when I do that? No? Alright, good. So you're just feeling just to make sure, he's not guarding or anything. Maybe he slipped and fell. The color of his chest looks fine. We already went over his acne, his freckles and all. No lumps, nothing like that. And his skin was warm, pink, and dry. It was warm when I felt his fingers. It was warm when I felt it a minute ago. I'm going to feel it again in a minute. So I'm going to inspect for any tremors, contractures, weakness, or pain in the muscles. So let me know if you feel any pain. Good. Good. I want to make sure I feel around those major muscle groups and bony masses. Good. No contractures from the looks of it. Skin warm, pink, and dry. Good. And good. And I'm going to go ahead and test his strength. So can you push up for me? All right, don't let me put you up. Good. Don't let me pull you up. All right, don't. Yeah, good lad. All right, hold your arms out like that. Don't let me push you down. Don't let me push you up. Don't let me push you down. Don't let me push you up. You're good. Now touch the sky for me. Move your arms down. Go up. Shoulder shrugs. Backwards now. All right, good. Wrists out. Put them down. Put them up. Squeeze. Good. And now go ahead and squeeze on my fingers for me. Oh my gosh, you're a strong guy. Good job. All right, so that was pretty strong. +5, honestly. And his muscles were good. No abnormalities. No lesions from what I could tell. Did anything feel tender to you? All right, so no tenderness in his muscles. And I didn't feel any spasticity, flaccicity, or tremors. And now I'm going to go ahead and palpate his radial and brachial bulbs. Good.
And yeah, there's
Good.
different estimates. There's different for like neurological.
Good.
Inspecting
Good. And before I do the deep tendon reflex, which I will do in a minute, I can see he doesn't have any JVD or anything like that. And yeah,
It's the same
we're
way you
good.
would do.
All right, so doing the deep tendon reflex. So go ahead and clench that up for me. All right, good. You can chill out.
The balance.
Yes, you close your eyes and extend.
Okay, good stuff. Can you flex that bicep for me? Good. All right, relax. Good lad. Alrighty, let it dangle, flex that. Good. All right, let it.
go ahead, uncross your legs. And
Good. All right, now this arm. Go ahead and clench that up.
Did you do my arms? Yes.
All right, good. Relax. Good. Get that little flinch. That was good. Flex that bicep. Fire that bicep. Oh, okay. Strong guy. Good job.
3, 2,
Good.
1.
Attaboy. Alrighty, now flex that tricep. Good. Relax, relax. Let it dangle. Let it dangle. Let it dangle. All right. So his deep tendons were good. So now I'm going to ask you to go ahead and lay down on the bed for me. Just keep your feet bent. Keep your feet bent for me. And I'm going to go ahead and straighten this bed out because I'm going to go ahead and move on to the portion of the abdominal assessment. So first things first, I'm going to inspect it. I'm going to inspect it for any contract. You keep that knee up, you understand me? It's
I
okay.
forgot. I'm not going.
It's okay. So I'm looking at all 4 quadrants. Any discoloration? No. Regular within normal limits. Hair growth for a male of his age and size. Symmetry is good. Some scars around there. How long have you had those?
For like forever.
Okay. Did they bother you?
That's from a past surgery. These are just from.
What was that surgery on?
This I had pylorexinosis when I was a baby.
Okay.
So that's what that's from.
So we're gonna document that just in case nobody else did in the past, although I assume they did. That's good. So now we're gonna auscultate all 4 of the quadrants. You been eating lately?
I just ate.
Are your bowel movements?
I've been pooping.
Okay, every day?
Pretty much, yeah.
All day, every day?
Oh yeah. Poop every help.
Okay, yeah, I can feel it. We're here. Ooh. Yeah, that one was strong. Okay. Okay, yeah. Dude, your stomach is growling.
I'm still hungry.
It's working, so that's good. He said he's still hungry, so you should eat. How's your diet?
It's great.
Really? Any kind of fasting going on?
I mean, I'm cutting weight. So I'm going under 2,000 calories. I think I'm at like 1.5.
Well, he sounds like he's knowledgeable in this, so I trust him. But if he wasn't, I would tell him, look, leafy greens, fiber, protein. Good job. So he's good on all that, but just a little patient teaching moment. So now I'm going to palpate his I'm gonna palpate his abdomen. Do some deep palpation, some light palpitations first. Let me know if any of that feels tender. I'm looking for any involuntary guarding from the guy. Looking good. Any of that feel tender? And I'm gonna do some deep palpitations. I want to feel around that. Nice and good. Everything looks good. Everything feels good. No rebound tenderness, no guarding. And now I'm gonna percuss. Good. Ooh, okay, good. Good.
I'll be shaking.
And good. Alrighty, and go ahead and dangle your legs off the side for me. You said that, yeah. Dangle the legs off the side. Alrighty, so now I'm gonna move on to the lower extremities. Excuse me. I'm gonna look for any abnormal coloring. Let's see. No abnormal coloring. Good. Everything looks good. Go ahead and stand up for me. That way I can actually get a better inspection. Import perfusion, no. Pull that up, no. You can go ahead and sit here and take off your socks real quick if you don't mind. And his legs look symmetrical, no tremors. I'm gonna feel his muscles in a minute. All right, so hang out there real tight. Nice. Just feeling around for any tenderness or pain or swelling. No? Okay, good. And now I'm gonna check his capillary refill down here.
I've read this with single eyes.
Alrighty, good.
Okay, I'm just gonna do the.
And that was good. And his skin is warm, pink, and dry. His feet are a little cold, but touching the floor, he just touched the floor, so that's fairly common. We're just worried about that. And his capillary refill was under 3 seconds within normal limits. I just felt around his muscles and bony masses. No tenderness reported for the patient, no swelling. I didn't feel any swelling or tenderness, no deformity, so everything felt and looked good from a medical standpoint. You got some scars right there, some nicks. You play soccer or football? Okay, is that what that's from? Okay. So in athletes, you may see something like that. His knees look good, no swelling or anything. I always want to feel around the knees for any surgeries that may have happened since he's an athlete. We know to feel for that. And I didn't feel any spasticity, elasticity, any pain or tenderness, tremors, nothing like that. I'm gonna go ahead and check his pulses. So back here, we got one. Alrighty. And his Achilles. Good. Dorsal peak. See that catch?
That was crazy.
And I felt your pulse while I did it. So it's a 2-for-1 now. Right back here. Good.
Alright, I'm almost done.
And here.
I think this is it.
And
We're gonna have to sit back down.
I'm really trying to find that one.
Yeah, whatever.
Alright, good. And now I'm going to check his femoral. So you don't have to move anything. I can probably feel it through here. I would want to remove that, but for the sake of the video, I'm not going to expose this guy like that. Alright, next one. Right here.
Okay. What I want to do now is I'm gonna
Alrighty.
put this point
And that was the femoral
on your foot.
pulse, so we're good. They were all palpable. And just real quick, you just stay right there. I'm going to check your skin turgor. He's hydrated. Lovely. His temperature felt good, normal, within normal limits. Skin was warm, pink, and dry. Nothing out of the unusual. I didn't feel any edema or swelling. Do you have any swelling or anything like that I should know about? No? So that's good. So go ahead and stand up for me real quick. Can you go ahead and do a little jiggle? All right, good. I'm checking the range of motion for those hips. And go ahead and bring your foot up. Other leg. Good. Now go ahead and like that, like you're wearing some heels. Other leg. Good. Now stand on your heels. Good. And now you can lay back down or sit back down. So I was just checking the range of motion for the knees, the legs, the ankles, and the feet. We had his heels down. Just keep them off for now. Don't worry about it. I promise you. Are you being bothered? Anything bothering you? Okay. Just want to make sure since you brought it up. Now we're going to check the strength. So go ahead and push your good. Now push him. Good. And down. Good. Up. Good. Out. And so his muscle strength of the lower extremities is pretty good, and I didn't do this earlier, but it's the cerebellar function. So go ahead and close your eyes, stand up, Good, good, good. Finger to your nose. Other one. Good. Now run your heel down this leg, your left heel down your right leg.
Do I need to keep my eyes closed?
Yeah, if you don't
It says
mind.
documented.
Good. Now the other one. Good. And I just wanted to hold them just in case.
With glasses.
Right, you can open your eyes
You
now.
would know.
Good, 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 good. I'm gonna go ahead. You can sit down. I'm gonna check your deep tendon reflexes. So I'm gonna check his knee real quick. Right there. Good guy. Very good. I'm gonna check back here. Good ankle. Good. Good here. I'm gonna feel for it. There it is.
I'm honestly surprised that there wasn't any today.
There we go. So it took me a little bit to find the Achilles one, but I did find it. And now, if you want to lay back down real quick, I'm going to go ahead and do the Babinski. So, all right, that feel funny?
Yeah.
Yeah? That feel funny?
I just wanted to go home today.
Did that. Go ahead and close your eyes real quick. And I'm going to have two objects. You let me know if it feels soft or fuzzy. Or let me know if it feels soft or sharp. My bad, not fuzzy. All right, close your eyes. How do you feel?
Not soft, whatever the other one was.
All right, so that's sharp.
Yeah. Soft.
Soft, good.
Not soft, the sharp.
Okay, good.
Soft.
All right, so his perception's pretty intact. That's good. Good for him. Go ahead and stand up for me real quick. We're almost done, I promise, kid.
You did two
All
as far
right.
on the
Can you go back there?
assessment.
And can you walk to me?
We get a
Or
break.
turn around. Walk back. All right, good. So his gait and balance seemed good, and yeah, we're good. All right, so real quick, I'm just gonna inspect and palpate his xiphoid process. I didn't do that earlier, but we'll do it right now. All right, everything feels good. Lastly, can you stand up for me? Can you just stand with your eyes closed for a minute? I did this earlier, but I didn't specify that it was the Romberg, so you're good now. He didn't swear anything, and I should have done this earlier, but since we've done all this, I'm gonna do it right now and, you know, throw him for a little loop. Where are you at, Jay? It's like,
I am at Blue Mountain Christian University.
so he knows where he's at. What's your name?
My name's Slate Gargis.
When were you born, Slade?
Born in 2004.
Do you know who the president is?
No, yeah, Donald Trump.
Okay, I was a little worried. So he's oriented to person. What day is it?
It is October the 2nd.
Good. He's oriented to person, place, time, and event. And thank you for watching my head to toe assessment video.